mynews.studio.
Picture this. A child in rural China receives a basic vaccine. Could that moment set off a change that impacts the future of cancer, not just there, but worldwide?
Let's get into it. Today is August 2nd, 2025. The statistics are pretty clear. Liver cancer is the third most common cause of cancer death around the world. Most people don't realize how preventable it actually is.
A recent analysis in the Lancet estimates that up to 60% of liver cancer cases could be avoided. We're talking about millions of lives, between 8 and 15 million, over the next 25 years, if governments act on three main points: hepatitis vaccination, healthier diets, and reducing alcohol consumption.
Let's unpack that. First, hepatitis B vaccination. Why is this step so crucial?
Hepatitis B is a leading cause of liver cancer, especially in East Asia and Sub-Saharan Africa. Taiwan is a good example. Back in 1984, they launched universal hepatitis B vaccination for newborns. The impact? Infections dropped to a tenth of what they were. Liver cancer rates among vaccinated kids and young adults went down sharply.
If the benefits are that obvious, why isn't every country doing this?
Some countries are, but not nearly enough. The main hurdles are political will, funding, and a strong health system. Universal coverage is crucial, especially for babies born to mothers with hepatitis B. Integrating maternal screening and keeping immunization rates high, those are key. But even with obstacles, the evidence from Taiwan is hard to ignore.
That's vaccination. Now, about alcohol, why does setting a minimum price stir up so much debate?
Alcohol is part of the social fabric in many places. Setting a minimum price can cut back on drinking, but it's often unpopular. The alcohol industry pushes back heavily. There's also worry about lost tax income, effects on businesses, or sales going underground.
Are those worries justified, or is it just pushback against change?
It's both. Economically, governments weigh the pros and cons. Socially, people often see it as too much government control. In lower-income countries, weak enforcement adds another layer. But research shows minimum pricing does reduce heavy drinking and its harms.
And for diet, do we know for sure that what we eat affects liver cancer risk?
Unhealthy diets, especially those high in sugar and processed foods, raise the risk by contributing to obesity and diabetes. Both are linked to liver cancer. Policies like sugar taxes or clearer food labels can help. But there's pushback from both industry and some consumers, especially if people feel targeted or financially squeezed.
So it's always this push and pull. Effective solutions exist, but political and economic realities slow things down.
Exactly. That's where public health campaigns matter. They need to fit the culture, involve the community, and tackle stigma and misinformation. For instance, working with respected local leaders, offering vaccination during routine checkups, and making sure information is available in local languages.
Stigma is a big barrier too. How do you convince people that hepatitis is a health issue, not a character flaw?
Normalize testing and vaccination, stress confidentiality, share real stories, and be clear, the hepatitis B vaccine is safe and prevents cancer. It doesn't cause it.
Do we have real-world examples of this working?
Taiwan stands out, but there are other places with high vaccination rates and strong education where liver cancer rates have dropped. It's a long-term investment, but you can see the results.
So, looking at the big picture, vaccines, better alcohol and diet policies, clear communication, millions of lives could be changed. Why isn't this being treated as a global emergency?
That's the question. Sometimes the answers seem too straightforward, or the challenges feel overwhelming. But the evidence is there. Prevention works, and the moment to act is now.
We've looked at the science, the barriers, and what's possible. It's not often you see this much potential to shift the course of a major disease.
And it can all begin with action, through policy, communities, and every child who receives that vaccine.
Thanks for listening. This episode was brought to you by mynews.studio. Give it a try for free.